Good afternoon, everyone. Welcome to today's SVS VQI Quality Improvement webinar on smoking cessation. My name is Jennifer Correa. I'm the Marketing Manager at the SVS PSO. I'm joined today by Betsy Weimer, SVS Director of Quality, as well as Carolyn Morgan and Melissa Lattis. Before I turn things over to Betsy, I do just want to go over a few brief housekeeping items. We will be keeping all lines muted throughout today's presentation, but we do encourage you to type any questions you may have in the Zoom Q&A box. This will allow us the opportunity to answer questions as time allows at the end of today's presentation. In the event we are not able to get to your question live during this session, we will reach out to you individually following the webinar. And with that, I'll turn things over to you, Betsy.
Thanks, Jen. Welcome, everybody, and happy Tuesday, March 12th. I think this year is already flying by, so thank you for joining us. So we have a few updates today for the smoking cessation, but again, we're just going to review what we've been chatting about for past few months. We'll talk about the smoking cessation as our third national quality initiative. Our two measures are pre-op smoking and also smoking cessation follow-up. Our National Quality Initiative reports for the future, a few resources, a couple of new ones that we've added, and then also we're going to be talking about a survey that will be distributed later on this week, beginning of next week, and then we'll do a Q&A if there are any questions. So again, what is a National Quality Initiative? And again, this is simply just an outcome or process measure that can actually be benchmarked. It's an achievable measure that can be reached by most centers through reducing variation or even a change in behavior. It's something, a measure that can easily tracked by our PSO analytic team. And universal adoption leads to an enhanced survival, improved quality of life, and a more successful procedural outcome. So as you are already aware, we already have two national quality initiatives, our discharge medications on antiplatelet and statin, and our EVAR sac diameter reporting at the 1-year long-term follow-up. So we added our third national quality initiative. We announced it last year at our VQI at BAM almost a year ago, and we call it our Can Do program. It's choosing against combustible nicotine despite obstacles. And we know that tobacco abstinence saves lives and improves our quality of life. And the VQI data demonstrates global approximately 25% smoking cessation for all cases across registries from the procedure up to a year long-term follow-up. The targeted intervention is proven to improve success with smoking cessation at the teachable moment. And when is that teachable moment? That's whenever you're using an ask, assist, and advised method. So when did we start this rollout? Again, as I shared, we announced it last year at VQI at BAM 2023. And we already had some smoking cessation variables within the arterial registries. And then we simply added just a few more variables. So currently, smoking cessation is in all arterial registries, which does include the HDA registry. We developed physician and patient smoking cessation toolkits, which is available at the SVS and VQI websites. We assisted SVS in elevating their profile and improving, having more patient-friendly resources on their website. And then we actually kind of built from scratch our own third National Quality Initiative resource on our website. As far as our reporting measures, we did introduce, again, the pre-op smoking and then also the smoking cessation follow-up. That's what we started last spring. I'll show you a quick snapshot of that coming up. But we also started thinking, what can we look at for the future? Our other two national quality initiatives, you can gain bonus points or participation points, if you make significant improvement. And those are captured basically if you're looking at 80% collection of, measurable outcomes and everything, if you're doing great with those measures. And the participation committee that met in January, they do agree that they would like to maintain the 80% overall. But again, right now we're so new that we have not come to a final decision on what that measure is going to look at. So we're still in the early stages of developing that. Not only that, but we also don't have enough data. Again, we just rolled this out. The variables went live in August, so we don't have enough data yet. So we just want to, start talking to you about that, and just wanted you to understand that we're going to probably do the same thing as our other two national quality initiatives are, and we're going to hold you to that 80%. But again, this is all very early. It's in the early stages. And if you have anything you'd like to share or thoughts or anything, we'd love to hear your feedback. So again, the National Quality Initiative will be for center level and physician level reports on the percentage of smokers that receive smoking cessation information. The reports will be at the percentage of the success of smoking cessation at long-term follow-up and patency. And again, a lot of this is going to be determined. Again, we don't have a lot of data right now. And also vision reporting on survival, hospitalization, and also re-interventions. So again, our smoking cessation variables are for arterial registries only. The reporting measures, they began in spring of last year. And again, for pre-op smoking, those are for elective procedures only. And then smoking cessation, we actually have a new label for that starting this spring 2024. It's called smoking cessation at follow-up. So I put that at follow-up in red. You'll be seeing that in your spring reports if you haven't already looked at yours. Make sure you look at those. And for smoking cessation at follow-up, that includes elective, urgent, and emergent. And again, we added, as I shared, just minimal additional variables, and those went live in August of last fall. So for the spring, this is what you're going to see. So you'll see the pre-op smoking and those procedures that were performed between January 1st and December 31st, 2023. You see all of your elective arterial registries there. And then the table that has all of the data gives the number of procedures meeting the inclusion criteria and the percentage of those procedures where the patient was still smoking within 1 month of the procedure. So again, your pre-op smoking is for elective procedures only, arterial registries, where they were smoking within 1 month of the procedure. And then here's your second measure that, again, you're going to see this. This is your springtime 2024 smoking cessation at follow-up. Again, it's a new naming convention, just added that at follow-up. And again, don't forget, your timeline is a little different here because it's follow-up, so you're always 2 years behind. So this is procedures performed between January 1st and December 31st, 2021. Again, you're going to see your arterial registries, but remember, this is for all of the elective, urgent, and emergent procedures. So again, it states any urgency status performed on patients smoking within 1 month of the procedure. And again, this will exclude procedures that do not have at least one long-term follow-up record where the patient's follow-up smoking status was reported. And then just further down, the table of your data does give the number of procedures meeting the inclusion criteria and the percentage of those procedures where the patient was not smoking within 1 month on follow-up for all long-term follow-up records where the patient's follow-up smoking status was reported. And then we move into our education and toolkits. So you have physician resources, you have physician resources for patients. There's also our hyperlink. So make sure that you go to our www.vqi.org website for all of these resources. Make sure you go to our members only website. And if you don't have a members only login, you can contact Jennifer Correa at jcorrea@svs.org. Oh, wait, I just said that wrong. I'm going to put that in the chat for you. I'll put her address for you in the chat. But anyway, she'll be happy to get you a members only access for you. The vapor trial, which I just wanted to point out here, this is also the top link right here under physician resources. It was a trial report that we actually used to actually discuss our CAN-DO program. So this is a great white paper that a lot of the physicians will want to read. They want to know, why do we select smoking cessation? This is just a wonderful paper to actually share with them. Also, billable codes. A lot of your physicians will say, hey, what would be something that may encourage me to actually discuss smoking cessation? Well, we have some billable codes for you. Now, while these are not all inclusive, make sure you speak to your billing department and ask them to help you find some. But these do have some ICD-10 codes and CPT codes that can help your physicians get these. And again, to have these billable codes, we actually spoke with Dr. Cassius Ochoa Char, and he provided, what he uses whenever he bills. And so this is just an example of what he uses. And again, this is a 3 to 10 minute, which is an intermediate version. And also Dr. Greg Weston, he shared what he uses for an intensive version for the CPT code as well. And again, these are all readily available at your fingertips. Something else that is quite interesting, in particular for patients, are the cost of smoking. And again, this is also in the patient toolkit as well. I apologize, I have a little sip of water here. And it's also quite interesting for them. 1 week of smoking equal movie tickets for a whole family, or 1 month of smoking could equal a smartphone. So anyway, a lot of times cost really drives it home for patients. Something else, again, that I shared with you is we worked hand in hand with SVS and improved their website and also started our website. And you can go back and forth and kind of go in between the two websites as well. We do have a direct link to SVS. As far as resources go, it does vary state to state in regards to smoking cessation. Like, for example, Michigan, they have a Blue Cross Blue Shield program, which is phenomenal in regards to smoking cessation. They have one of the best programs, I have to say. Also, there's also various societies and federal resources available. We wanted to make those available at your fingertips as well. A lot of the programs are 1-800-QUIT-NOW. So that's one of the most popular. And that actually covers states and provinces. So that was one of the most used resources available. And also, of course, CDC, American Lung Association, American Cancer Society, and WHO as well. But also, we have Canadian resources. We also have Puerto Rican and Singapore because we do have participants in all three of those areas as well. Those are available at your fingertips too. And then also on the website, we have sample charters. If you're considering starting, smoking cessation charters, right now I think we have, it's either 2 or 3. I know I have 2 for sure. I'm maybe putting another one on later this week. But anyway, I just wanted to kind of give you a general overview of what some centers are looking at. And this one was, the primary goal is to increase smoking cessation for all patients that are identified as current smokers. And their scope is to include all patients seen by their medical personnel involved in inpatient and outpatient. So this facility actually has inpatient and outpatient care. And then they have a lot of various deliverables, including this center in particular is working with their EMR. So I thought that was quite great. And they're also developing educational literature, their pamphlets. So they also have a quit hotline as well, and a relapse prevention counseling. Now, your center may not have all of this, but don't worry. Feel free just to use this as an example, and maybe even use it as consideration for something that you may want to do at your own center. And then here we go with the resources required. Obviously, for their EHR, they may need IT support, and then anyone involved in patient outpatient care, their outcome metrics, and then their milestones. They put their date and then their year, and then their process metrics are all patients that are smoking or documented in their initial visit and follow-up visit within the smoking cessation database /EMR. And then again, their team members. This is so important to have a collective team that you can kind of count on, bounce ideas off on, celebrate your successes, and learn from your errors. That's how we all grow, and just learn from what you can do and what you can't do. within your own center and also within your own network, speak to one another. And that's another thing about um, these calls, and also VQI at VAM, the poster session networking, and even just being at VQI, just speaking to one another. Also our data manager meetings at within your own region, regional lead data manager meetings. I mean, there's just so much networking that you can do and share about your own team within your, center or your charter. Another sample charter, and this one was just a little bit more robust, only because this is a larger facility. And it actually just gave different examples that, even a smaller center, they may have different thoughts or different pieces of this charter. So I wanted to share this one as well. And you can see um, they have motivational interviewing, education at the point of service. They have quit kits. They have websites, texting and calling and cessation programs. They have in-person coaching and support. And they also work with their pharmacy on prescriptions. So again, while your center may not have this, you may have a little piece of this or another. So again, their scope, they actually included all of their registries here. And then their resources, they're actually looking at grant funding. So, maybe you may get an idea from these charters that you may want to pursue also. And again, this one is focusing on their pharmacy as well. They also use either Cerner or Epic, and they had a program that they called their ABC tracking. So again, this is just something different that I like to share with everyone as well. And again, they're deliverables. I mean, they have a lot of deliverables, something that you can look for, like a sustainability plan, a toolkit, and just using the toolkit and offering what we have online, you could utilize that. They also have a referral process development, a baseline analysis of smoking prevalence. So again, this was a larger hospital, but again, it's a great resource for you to come back and look at. And then also their metrics and then their milestones, and they actually decided to put a number on it. So for their outcome, they said 3 patients will successfully quit smoking after completing their specific smoking program by 1 year after their launch date. So they actually put a specific number on it. You do not have to. And again, I always encourage centers to start small, because you always want to see a little success. It always makes you feel good. And then once you have identified what works well within your center, then progress with, 10%, 15%, start off small, just do something positive. You don't want to start something big and then, set yourself up to fail. We don't like to see that. So, and then again, their process metrics, they said that 85% of their vascular patients during their time frame would receive, they're screened for smoking status, basically. So, and if it's that percentage you feel like is, worthwhile and you can actually achieve that, I say go for it. But again, just don't set yourself up for failure. And again, they're team members, and they have a very large team member of their cardiovascular director, ACMO, primary care. So they're even networking with their primary care physicians, which I think is phenomenal. IR, their pharmacy, cardiology, vascular. So I think it's great. And then again, other resources. You got, again, as I shared, patient, physician resources. You've got toolkits, SVS connections, future podcasts, charters, webinars, and you've got mentoring and networking. So there's just a healthy group of resources right at your fingertips. All you have to do is just go to www.vqi.org. And then finally, a certified tobacco treatment specialist survey. So in learning about smoking cessation, we have found that there is a CTTS staff member that has become quite common at centers. And we are learning more and more about this. So in collaboration with SVS, we're sending out a survey, and we're just trying to better understand this role in smoking cessation. And it's literally just a 2-minute survey. And basically it's like, are you aware of this role? Do you have this role within your facility? um, that sort of thing, because we really are trying to learn about it. I'm actually considering taking this certification to become certified in smoking cessation, so I can help bring more awareness about our National Quality Initiative. And so once we learn a little bit more about this, then we'll have more to share from you. But we would like to ask that you would just take just a couple moments to take this survey, as it will benefit us in regards to our National Quality Initiative. And I would like to ask if anyone has heard about this, if you could type in the chat if you have. If not, don't worry about it. But if you have, if you could just chat yes, and if you're aware of the programs. The programs are currently across throughout the United States, and they do vary whether they're online or in person. So the closest one to me that I've found so far is either at WVU or South Carolina. So, but they're pretty intense. What I found is they're usually about 3 days in length. But it's also a great networking program as well. And again, it's just a certification. But again, it promotes and prepares you for smoking cessation. So again, just learning about this and how this role plays out. So anyway, yeah, if you could just take the survey once it is delivered, it should be going out either the end of this week or the middle of next week. And with that, we will open it up for questions. And again, it was jcorrea@svspso.org for members only access for the VQI website. And do I need to go back with any slides at all? So just want us to, oh, I'm sorry. Sometimes the chat is disabled. So if you want to put a question in the Q&A, that's fine too. Can we review the pre-op smoking slide again? So this is for elective cases. So hold on, we'll go back. Make everybody dizzy just for a moment. Sorry about that. All right, so pre-op smoking. So again, this is for your spring 2024 reports. It's the procedures between January 1st and December 31st, 2023. Includes elective only. And again, it's for arterial registries. And it's going to be the procedures where the patient was still smoking within 1 month of the procedure. And the slides will be available. It won't be on the Pathways registry. It'll be on the VQI website. So Neil, just make sure that you have access to the VQI members only. And the slides will be up right by the end of today. Jen, do you think, or first thing tomorrow?
Yeah, right around then.
Okay. So that's the pre-op smoking. And then, oops, sorry. The smoking cessation at follow-up, again, remember this is 2 years behind. So this is going to be January 1st through December 31st, 2021. So this is all cases, any urgency. So elective, emergent, and urgent for arterial cases again that are performed on patients that were smoking within 1 month of the procedure. But it excludes the procedures that do not have at least one long-term follow-up record where the patient's follow-up smoking status was recorded. So they have to have at least one follow-up recorded with a smoking status. So Jody, I don't have the variables pulled up as to the variables that are in smoking cessation at follow-up right off the tip. Carolyn, you don't happen to have those, do you?
I don't have them pulled up, but if you answer a couple more questions, I will have them momentarily.
Absolutely. Thank you. And it's the follow-up that she's wanting to know.
Okay.
And I believe pre-op smoking is, what did they, the history of smoking, are they smoking currently? Yes, no. And Carolyn's done a phenomenal job with doing the help text. Everything is written out specifically, spelled out in the help text.
I even annoy myself. All right, how can I help you?
So it was the percentage at follow-up. Is it smoking cessation?
It's the percentage of patients that were smoking at the percentage of patients, elective patients that were smoking. No, excuse me. It is a percentage of all patients, regardless of urgency status, that were smoking at the time of their procedure that have stopped smoking at the time of their long-term follow-up. And if there was any documentation from the time of discharge until the time of the 9 to 21 month long-term follow-up or 1 year follow-up window, if there is any follow-up during that time frame that the patient is smoking, then it is still considered, yes, they are still smoking. So that's confusing. So let's say a patient is smoking at the time of the procedure, they're smoking at their 30-day follow-up, but they quit at the 1 year follow-up, they're still considered smoking because there was documentation of one follow-up entry that the patient is still smoking. If the patient is discharged, they have a 30-day follow-up and a long-term follow-up, and each of the follow-up statuses, I'm taking this back, 30-day does not collect smoking status unless there was a complication. So let's say the patient ended up with an infection and they had to be hospitalized to treat the infection, and they were still smoking at that point. Any documentation on a long-term follow-up form that a patient is still smoking will be considered or counted at yes, even if during the formal 1 year follow-up visit, they are no longer smoking. Does that make sense? As clear as mud?
Just waiting for her to answer. And also, why was pre-op smoking only elective and follow-up all urgency?
So pre-op, as you know, Betsy, if you come in with a cold leg or somebody that needs to be done urgent, they haven't been counseled or had time to try to quit.
Correct.
But at long-term follow-up, they were counseled at discharge, and they can make a decision whether they want to continue smoking or stop. But they've had time to make their decision and then follow through on their decision.
Jody, does that answer your question? And Brooke? Oh, so Jody, the quality initiative the measure has not been determined yet. We don't have enough data yet. These are just two measures that we're looking at currently. So like we have our national quality measures for EVAR, sac diameter, and discharge medication. Those have not been determined yet for smoking cessation. It's too early. We just implemented all of the variables as of August 31st of last year. So we truly don't have enough data to really determine yet. And the participation committee just met in January. So it's, we would like to look collectively at all of the measures and have centers meet both measures, the pre-op and the smoking cessation at follow-up at 80%. But, we're just not there yet. So. And yes, Carolyn, it does answer their questions.
Thank you.
So thank you. All right. Well, I think that is all the questions that we have. So I want to thank you all for joining us today, and the slides will be available either late this afternoon or by tomorrow afternoon, close of business. And we want to thank you for joining us, and I hope everyone has a great day. Take care, everybody.